So what are the reasons that people come in to see you?
Number one reason is I want to look better. That's probably the top reason that patients come in to see me. And you know, I've been doing this a long time, and to me I just assume everybody knows about Botox, and everybody knows about dermal fillers, and everybody knows about photofacials, and that's just not the case. And what typically brings people in to see me now is my art form. So I tend to create very natural looking faces because I want to recreate youth and beauty as opposed to fill holes. And so that's kind of my artwork, and I don't want people walking around with faces that I can't be proud of. And as a result of that, it's interesting because I will get people who come in and specifically make comments about the Academy Awards, and even though they've seen their friends have a nice result, they're still worried that I'm going to do something to them that is going to make them look freakish or Hollywood bullish. And so that actually guides me in terms of the choice of fillers that I choose in the work. So if somebody's never had anything done, I'm going to pick things that are going to not last a long time. And the reason being, hey, let's just take your face, let me recreate youth and beauty, let's see how you like it. And if everything's great, then as the products start to wear off, that's when we'll have you come back and we'll consider more long-lasting products. The reality is, the healthier the skin, the longer all of these treatments last. And the more combinations that we do of treatments, the longer the treatments last. So if we do photofacial treatments or BBL treatments, Botox lasts longer. If you have Botox in the skin, photofacial treatments last longer. If you have really unhealthy, leathery skin, Botox is just not going to last very long. So, the last thing I want to do is have unhappy patients who wants to come in, spend money, get a result, doesn't last very long. So I will bring people in for the first time. We take a series of photos so that I can determine how that particular person's face and skin is aging. I will also take a series of computerized photos, and in those computerized photos we find how much sunspots there are, how much redness is in the skin, is there a lot of bacteria, what does the UV damage look like, and then we come up with a plan to do a series of treatments to help repair the skin, and then allow anything else that we're doing to be much more long-lasting. Most of the people who come to see me, they don't come to see me because they want to look like the Hollywood starlets. And in fact, when I first started my practice in 2005, which was focused specifically just on aging and skin, I had trouble getting referral patients because they didn't tell any of their friends that they got anything done. So they would just, oh, well, could you recommend me? Well, I don't want anybody to know, and you've done such a nice job that nobody knows I've had anything done. And so initially it was a little tricky getting patients to refer, but what's happened over the course of the last 10 years is, and what I'm hearing more, is that people come in and I ask them, how'd you find out about me? And what they tell me is that they went to their yoga instructor, or they went to their stylist or whatever, and stood back, took a look at their faces and said, okay, you're looking really good. I know you're doing stuff. Who'd you go to? And so I'm now starting to get an assortment of referrals that way. I consider myself a facial restoration artist. I'm Italian, so it kind of goes. It follows my history and my roots.